Diabetic MD, Case Study 23.
Let me give you a bit of history about this patient, if I may. As you can see, we have a below-the-knee amputation stump. This is a very interesting patient with a very interesting history. As you're aware, there's a significant amount of peripheral arterial disease in the media, and of course, increasing due to our dietary habits, as well as the increase in diabetes. What happened in this unfortunate patient's case was that she developed advanced peripheral arterial disease, developed gangrenous changes of her lower extremity, and unfortunately was forced to undergo a below-the-knee amputation. Now, an untoward complication occurred whereby her circulation was poor to the point that the incision did not heal, and she was left with, as you can see, an open wound.
Well, I was diagnosed with peripheral artery disease 3 years ago, and at this time I was working, and I was in a lot of pain, and so he put me on a Doppler, and anyway, they found out that there was hardly any circulation into the foot area. So at the end of all of this, and he did not have any other choice than to amputate the leg. And after it was amputated, it's been a long road in the healing process. It just does not want to heal up correctly. My vascular surgeon recommended that I get above-the-knee amputation, and I was totally shocked by this. I was totally down in the dumps, and that's when I called Dr. Miller, and he had introduced me to this product. And I would encourage anyone to use this product.
My first reaction when the vascular surgeon told my mother that she would have to have an above-the-knee amputation was first sort of despair that nothing that he was doing was working, sorrow for her in her situation, realizing that she had already been through so much, and to have to start all over with a new above-the-knee amputation, not only for healing purposes but as well as her morale. Just to see the look of desperation on her face when she came out of that doctor's appointment and said, he wants to go above the knee, there's nothing more he can do. At the time of her first visit with Dr. Miller, his very first inclination was that there's no need to give up hope. There are things that we can try that are not so radical. At that time, he recommended a product called Aminoplex, started using it at that first visit, gave us instructions on how to use it at home, and that treatment has continued for approximately a month now, and the results have been absolutely amazing. She's encouraged every time she comes to the doctor, because the wound, in fact, is getting smaller and has much more redness where the vascular veins are starting to come back to life due to the use of this product. This product has been a blessing to our family.